Hi, good evening, everyone, and thank you for joining us for tonight's COVID-19 Community Town Hall, which is presented by UP Health System Portage. I'm Steve Elmer, a college professor and member of the Health Research Institute here at Michigan Tech University. We want to give a warm welcome to all of you for joining us. Those tuning in on 97.7 The Wolf Radio, 99.1 WIKB, those of you listening and watching on Facebook Live, and also joining us on the Zoom webinar. It's great to have you with us here tonight. Our topic will focus on the impact of the COVID-19 pandemic on the environment and climate, and we have an all-star lineup here tonight. So excited to introduce them here in just a few minutes. Just a couple of announcements, and then I'll also welcome in my colleague, Kelly Kam, to provide a brief public health update. Before we get into things, I want to recognize our sponsors, which include, once again, UP Health System Portage, the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, along with their Iron Area Health Foundation, and the Physiological Society. We greatly appreciate the support of our sponsors, along with the Health Research Institute that organizes the Town Hall series. Their mission is to help support health-focused research, education, and outreach here in our rural Upper Peninsula communities. The goal of each Town Hall is to increase our awareness about COVID-19 and how it impacts our health and the health of our society and community at large. To do that, we'll bring in a panel of experts to not only provide information, but also answer questions from you, the community. I want to remind you that if you have missed any of our previous town halls, we've covered a broad range of topics starting back in September. These are free. All of the recordings are available on our website. This is a public website. If you go to mtu.edu/health-research, you can download those and watch those at any time. Once you're on the page, just be sure to click on Town Hall and you'll be able to pull all of those up. Also want to remind you and help us spread the word that tonight's broadcast will be re-aired on ABC 10 TV and Marquette at 12 p.m. Eastern. So again, help us spread the information to keep our community here informed. Next, I want to welcome in my colleague and co-moderator for tonight, Dr. Kelly Kam. She's an epidemiologist by training, a member of the Health Research Institute. She's been working very hard to keep our campus community safe by leading the contact tracing efforts. So Kelly, it's great to have you back here. It's been a month since our last town hall. I hope you're doing well, and can you start off by providing a brief public health update on all things CDC guidelines, COVID variants, cases, and of course, importantly, vaccines?
Thank you, Steve. Yes, spring has sprung here in the Upper Peninsula. We finally have a couple days without snow, and I know everyone is excited to be out and about, but I do want to remind everyone we're not through this pandemic yet. Michigan, as many of you who live in Michigan may have known, we have had a surge in cases in the last month. Across the United States, we're at just over 32 million cases since this started a little bit more than a year ago. In Michigan, we've had about 33,000 cases in the last 7 days. So we were doing really well, and then in April really took an upswing, which is what increased the need to do some of the recommendations for increasing our community mitigation policies, like keeping our distance from everybody, wearing our masks, and washing our hands. We have had quite a surge in Michigan, as I said. Much of that is due to this new variant, this B.1.1.7 variant, which is now about in our region, so in the upper Midwest region, we're at about 67% of our cases are due to this B.1.1.7 variant, which is 50% more infectious. So as we get more and more people vaccinated, that's wonderful news. I encourage everybody to go out and get vaccinated, but we do need to continue with our 4 W's of wearing your mask, washing your hands, watching your distance, and making sure now that, especially now that it's really nice out there, get out and go for a walk, keep yourself healthy. On the vaccination front, so across the United States, we have almost 144 million people who have had at least one shot over 16 years old. So that's about 43% of our overall population. As we look at the groups that have been on those lists to be eligible for vaccination longer, more people are vaccinated. So our older population, 65 and up, are doing really well with the vaccinations. We need those of us in the younger groups to kind of catch up to those individuals. In Michigan, we've had over 4 million people that have had doses of vaccine given. In our area up here in the Upper Peninsula, about 50% of our population that is 16 years and older has been at least one shot of the vaccination. So that's good, but we still have a long ways to go, especially because this new variant is running around rampant in our populations. So Contact your local health department to get on a list for vaccination, your primary care provider, any of the health centers in your area, including the tribal health centers, as well as any of our local health systems. So many of those have online ways that you can sign up, or you can call in and get appointments. Appointments are available. And now that we have all three vaccinations are also available. So the one-shot Johnson & Johnson is now available again, as well as the two-shot series, both from Pfizer and Moderna. So please consider getting vaccinated if you're not already. It not only protects you, it protects our community, it protects your loved ones. And as Steve mentioned, I do the contact tracing on our campus. I had that group of amazing students that are putting in their time to do this. And I can say that from a group of individuals who are identified as close contacts, yesterday I was able to give quite a few of them good news because they were fully vaccinated prior to their exposure. They did not have to quarantine, and that was the best news I've been able to give students in a long time. So absolutely go out and get vaccinated.
Thank you so much, Kelly, for the update. I have a question and one comment for you. First, the question, can you just talk about the importance of that second dose of the vaccine? I've been hearing things in the news, people are getting the first dose, but how important that second dose is, and what to do if you've only got one and missed your second dose.
Absolutely. So the information that we have and the studies that have been done on the efficacy of the Pfizer and the Moderna vaccine, of that 95% efficacy, are based on 2 shots. So it's just like many of our other vaccinations, it is critical to go get that second booster so that you can be fully protected. Now, nothing is 100%, but you are in much better place to get that, to be protected with that second vaccination. If you don't have the second vaccination, you would have to quarantine again. So that if that helps encourage you to go get it. For our students or anybody else that's really mobile right now, the one-shot Johnson & Johnson has been really nice because you don't have to come back for it. But if you, no matter where you're going, if you're a student finishing up finals and getting ready to head home, get that first shot, get the second shot when you get home. Make sure you have your vaccine card so you know when you got the shot and which brand you got, and that'll help your provider at home. But we can get you that second shot. Don't worry about it. Get out there and get that first shot, and make sure you do follow up. And if you kind of missed that window, you're supposed to come back at 3 weeks or 4 weeks, contact your healthcare provider. There's a lot of guidance out there that it's still good to go get that second shot, even if you missed that window a little bit.
Okay. And Kelly, my comment, I just want to reinforce, you mentioned the 4 W's. That's kind of a slogan here we came up with, I think, on our town hall. Wear a mask, wash your hands, watch your distance. And that 4th one, I'll just comment on: walk to stay physically active. Since our last town hall, there was a landmark study published. So new research is coming out. And really what the message is that being physically inactive, so not really being active, is emerging as a new risk factor for severe COVID disease. So going to the hospital, being admitted to the ICU, and unfortunately dying. And so we expect and are optimistic that fairly soon that'll be recognized on the CDC website. So one of the most important things we might be able to do is encourage our family, friends, people close in our pod to get out and walk, like you said. So thanks for bringing that up.
And absolutely, if I can add in one more thing on that. So the new CDC guidance too, as well with mask wearing, is that going out for a walk, if you're by yourself, keeping that distance, you don't need to wear your mask. So absolutely get out and be physically active. And if you keep that distance, no masks, and if you're vaccinated, you're good to go with being out there and enjoying the nice weather we have.
Okay, once again, thank you, Kelly. To keep us moving along, next I'm going to welcome in a guest moderator. Kelly and I work collaboratively here, but we have a guest, William Lytle. Will is a doctoral student at Michigan Tech University in the Environmental Engineering and Policy program. So Will, great to have you here with us tonight. You've really been instrumental in organizing the session tonight. And Will, can you go ahead and formally introduce our panel for tonight?
Yeah, thank you, Dr. Elmer. We have a great group tonight, and they cover a lot of different expertises. So I'm not going to waste time telling you about them. I'm going to let you talk about their work. So we have kind of 6 segments, and we kick it off with Rose Turner, who's a student leader working with the Sustainability Demonstration House here at MTU. Then we move over to a postdoctoral associate, Sonia Ahmed. And she's in the Civil and Environmental Engineering Department at Tech, and she works on a food, energy, and water project. Daryl Harmon from the US EPA. He is the senior associate and advisor of this group, definitely. He gave us a quick intro of what he's going to cover before we started, and he really knows his stuff, and we're going to definitely benefit from it as the audience. Then Rob Handler is the operations manager and senior research engineer with the Sustainable Futures Institute at MTU here. Denise Swanke with the National Park Service, and I believe, are you tuning in from Isle Royale? Yep. So we've got eyes out on the island, which is probably the best thing we could have now. Look at that beautiful. Gonna probably have the sunset coming up here soon. And then closing remarks, we have two more student leaders, and they are associated with the Kiwana Youth for Climate Action. So these are activists, Elise Roski and Gabe Arndt, and they're doing great work in the community and with Michigan Tech as an institution. So I think you'll be excited to hear what they've got going on this year as well.
Okay, thank you very much, Will. We really appreciate it. With that, we're going to turn it over to Rose Turner, so to speak, to help us formally kick off our town hall tonight that's focusing on the COVID-19 pandemic and its impact on our environment and climate. Rose, take it away.
Thank you, Steve, for inviting the MTU Sustainability Demonstration House to give the opening remarks for tonight's town hall. I could spend my time discussing the negative impacts COVID has had locally on our environment, such as the large amount of mask pollution, the absurd amount of single-use items that have replaced our reusable ones, and an increase in medical waste. But instead, I would like to bring to light something much greater. The most impressive result of COVID's impact on climate change is the positive actions our local Kiwana community took in response to these challenges. MTU student organizations, community groups, and many individuals did not view the COVID pandemic as a roadblock, but rather as a source of fuel to our fire to make a change for the better of our environment. I want to specifically highlight the following groups and their accomplishments to show how much our community is progressing toward fighting climate change in these challenging times. The MTU Sustainability Demonstration House organized and hosted 2 waste reduction drives in the past 10 months that resulted in the diversion of well over 100,000 items from the landfill, all of which cannot be recycled curbside in this area. Students for Sustainability established composting on campus this past September, which resulted in thousands of pounds of food waste going directly to a local farm to be converted into fertilizer. Kiwana Youth for Climate Action held many climate change protests and achieved their goal of 10% of MTU students desiring to see MTU divest from fossil fuels. And finally, Copper Country Recycling Initiative just this month established single stream recycling at the transfer station to keep an even greater amount of waste out of the landfill. It is our hope that everyone attending this town hall tonight takes this positive energy into their own hands and uses it to continue combating our community's climate change issues.
We appreciate it, Rose. We're going to move right on to our first speaker here. We have Sonia Ahmed, who's a postdoc associate here in the Civil and Environmental Engineering Department at Michigan Tech University. Sonia, thank you for being here, and go ahead. The platform's yours.
Thank you very much. It's a pleasure to be here with all of you and to hear about the really compelling and interesting responses to this sort of very tumultuous time that we're all living through. So as Will said, I'm a postdoctoral associate at Michigan Tech with the Food, Energy, Water Conscious Project, which is led by Dave Watkins in the Department of Civil and Environmental Engineering. FUCON is a 5-year National Science Foundation funded project that is looking at reducing household food, energy, and water consumption through a quantitative analysis of interventions and impacts of conservation. And my contribution to this project is through an NSF Rapid grant to look at the way that the COVID pandemic is impacting food and energy water consumption at the household level. And a couple of speakers down, Rob Handler will talk about environmental impact and climate impacts of these changes that we're seeing. So specifically, one of the many things this project is doing is a study of approximately 150 suburban households in Lake County, Illinois, in collaboration with researchers at Rutgers University. This study is looking at the actual food, energy, water consumption of these households over an 18-month period through a tool called Home Tracker developed at MTU. We're also asking participants to answer ongoing questions in specific surveys about their daily practices in terms of food, energy, and water consumption, and how the pandemic has upended these practices. This area in Lake County, Illinois was under a stay-at-home order from March 21st, 2020 to May 29th. And so essentially people had to stay home. They were working at home, they were attending classes at home, but they had to leave home to procure food, whereas water, electricity, and natural gas were still coming to people's homes. The households had to make new decisions under lockdown orders about how to get food. And so what I'll touch on briefly here is a couple of things. So the larger patterns of food insecurity that we're seeing during the pandemic, disruptions to the food supply chain in general at the national level starting in March of last year, changes in overall food consumption patterns, and then I'll share, if I have time, a few specific findings from our study. And so the first point I want to make is the decrease in income and job loss that affected everything else. So that these stay-at-home orders meant a loss of income, a decrease in money for food. And in an early April 2020 survey, 45% of respondents reported job disruption or loss. 20% had a reduction in hours and income, 16% had lost their jobs, and 9% had been furloughed. In terms of food insecurity, there's approximately 40% increase in food insecurity during the COVID-19 pandemic. So to put some concrete numbers on that, there were about 37 million Americans experiencing food insecurity. Before the pandemic started, that number jumped to as high as 54 million, so an increase in including 18 million children, and so an increase in percentage from 11 to 17%. And so to avoid food shortages and increase social distancing, in March 2020, FEMA recommended that people buy groceries 1 to 2 weeks at a time. Panic buying led to an increase in demand for shelf-stable food products such as pasta, rice, canned goods, flour, frozen foods, bottled water. In addition, people bought more comfort and indulgent foods to cope with the stress of the pandemic. Grocery sales increased by 26% from February to March, creating shockwaves across the supply chain for producers and distributors. At the same time, farmers were struggling to find workers and determine whether they should change their crops that they were growing or end production for the year. We saw multiple closures of meat processing plants and food price increases. And so having given you that background, I'll share a couple of specific findings from our study, which again was a sample of about 150 households with a median household size of 4. 70% of our respondents were female, 84% were white, 5% were Black, 2% Latino, and 4% Asian. There were seniors, that is people over the age of 65. In 20% of these households had one or more household members over the age of 65. And this skewed to the population skewed to large amounts who had completed college. So we had 25% having completed bachelor's, 49% master's, 11% doctorate. And in terms of political views, this population was 12% liberal, 12% very liberal, 40% liberal, 41% moderate, 7% conservative, and 1% very conservative. And of those participating in this study, we had 67% who reported to always shopping in person prior to COVID-19, and only 32% doing that during the COVID-19 pandemic. So a 34% change. There was an increase in procuring food from less busy stores to avoid crowds. A slight increase in participants reporting using meal kit services. We had 64% reporting stocking up on food prior to the March 21st stay-at-home order. And a majority of participants reported buying more groceries per trip. As well, of these participants, 51% reported they'd purchased more and much more frozen foods, 50% much more snack foods. And then a funny one was 43% had purchased more and much more eggs. So we have a lot of really interesting qualitative study from this survey as well, but I think I've reached the end of my time here, and I'll leave it to my colleague Rob Handler to pick it up on the environmental impacts of some of these changes that we're seeing in the study. And thank you very much.
Okay, thank you, Sonia. We'll have an opportunity for questions. I just want to remind our audience that there's 2 ways to ask a question. If you're on the Zoom webinar, you can use the Q&A button at the bottom. If you're listening on the radio or joining us on social media, we do have an email address. It's townhall2020@mtu.edu. Please send us your questions. And we'll have a little bit more time later for questions and answers with the speakers here. Next, we're going to move on to our second speaker, Daryl Harmon, who is a senior advisor with the United States Environmental Protection Agency. So Daryl, great to have you with us here tonight, and the platform is yours.
Great, thank you for having me. I'm really happy to be here. I'm going to run through some basics on air pollution and end up talking about the effects of COVID on air pollution. I think it's important to understand that the stuff you're breathing is actually 21% oxygen, 78% nitrogen, 1% other inert type gases. And the amount of pollutants that we care about are incredibly small. Just for scale, if you took a ball and painted it and then increased it to the size of the Earth, that one layer of paint would represent the thickness of the atmosphere. So we consider that tiny and finite. And for instance, I'm going to talk a lot about particulate matter. Levels of particulate matter we consider bad. Converted to a reasonable percentage, 1/100,000th of a percent is a significant amount of particulate matter to have in the air. So the scale is really, really tiny, and it doesn't, I mean, on a relative scale, it doesn't take very much of a material to become a problem. So there's a handful of major pollutants and a whole bunch of hazardous pollutants, two giant categories. Major, or what we call criteria pollutants, are those that are widespread and ubiquitous and harmful. So things like carbon monoxide, particulate matter, products of combustion like oxides of nitrogen and sulfur, widespread, need to be controlled in general, major pollutants. Hazardous pollutants, we have a list of 187. These are things that you don't want to be exposed to, but aren't at a level where they're widespread and ubiquitous in the environment. Things like benzene in gasoline, solvents, mercury, things that you don't want to be exposed to, but again, aren't widespread. So where do these things come from? But far and away, the most common place is combustion, burning fossil fuels, burning wood, heating your homes, running a power plant, and transportation, cars, fuel. Huge amounts of pollution come from burning things, and a lot of that is related to activity. So I will get to more details about when activity levels change, pollution levels change, and that's going to be really relevant to what's happened with air pollution and COVID. But I want to focus on particulate matter. It's probably the most hazardous substance to most people that becomes an air pollutant. And when I say particulate matter, you might think dust, and I used to think dust, but over my career, we've learned that it's really the finer and finer particles that are interacting with your body and causing health effects. And so we're down to PM 2.5, which is a particle less than 2.5 micrometers, or about 1/30th of the width of a hair. These cause serious health effects, and I'll just talk briefly. The interesting thing that we've learned is that PM 2.5 not only gets all the way into the oxygen exchange mechanism in your lung, it crosses that barrier and circulates in your body and is capable of causing all kinds of health effects: hypertension, inflammation, heart disease, lung damage, diabetes, stroke, chronic obstructive pulmonary disease, and lung cancer are just some of the effects of chronic exposure to particulate matter. Risk increases with exposure. That means the amount you're exposed to and the length of time you're exposed to that increase your health risks, and those health risks are magnified by exposure by COVID. The other one is the hazardous pollutants. They also cause respiratory stress and correlate to a 9% increase in COVID death rate and increased risk of other severe effects. So I want to just touch on a big initiative of EPA now is environmental justice. And environmental justice is learning to address disparities in effect of pollution on different populations and depending on where you live. So if you live closer to a source, if you live in a more polluted area, you have increased risk. If you live in a high density area, if you have lower education, if you're older, and if you're ethnic, a minority, you have a greater risk. And for instance, The death rate in Black neighborhoods from COVID is 49% higher than in white neighborhoods or wealthier neighborhoods. So big effect from COVID there. So the good news is COVID dramatically increased activity levels for temporarily. And that came along with measured decreases in air pollution. PM 2.5, the average in the US fell by 13%, and in parts of California as much as 45%. So a huge decrease, or a significant, very significant decrease in the amount of air pollution in the atmosphere. Interestingly, one of the questions was, have we exported pollution? And the answer is absolutely. If you go to less developed countries where we've sent a lot of manufacturing jobs, we've also sent the industrial processes, the combustion, the energy production, and the pollution. And in those places, pollution has fallen considerably more, but again, temporarily, but only because it's so high and so concentrated, and it's so closely related to activity. So the good news is that air pollution has fallen in response to COVID. The bad news is health risk has not. The health risk from exposure to air pollutants, and especially particulate matter, is chronic and ongoing. It doesn't decrease just because you get a temporary reprieve from the air pollution. So the horrible part is that people that are subject to greater effects from air pollution are also subject to greater effects from COVID because the air pollution went down, but the risk didn't. So in a study of 3,000 US counties that represent more than 90% of the population, they found that a 1% increase in particulate matter over the average equates to an increased COVID death rate of 15%. So we're still struggling with dealing with those effects because they're chronic, they're long-term, and they exist even though the pollution is gone. It would likely take years, this isn't studied, but likely take years of lesser exposure for your risk to start to go down to be equal with that of the general population. And internationally, really interesting data, the COVID deaths caused by air pollution, in China, 27% of the deaths were caused by air pollution. In the US, they attribute 18%. And in New Zealand, 1%. What's the difference? Hardly any air pollution in New Zealand, not as industrial as other countries. And then I really wanted to touch on indoor air quality. I'm not a health guy, although EPA's mission is to protect human health and the environment. I claim a little expertise in air quality, but for indoor air quality, I think it's important because that's where most people spend most of their time and where they would risk getting exposed. It's important to understand that exposure time and concentration equal risk. So if you're exposed briefly, risk isn't as bad. If you're exposed to a low level of virus, risk isn't as bad. But as you increase either of those, your risk increases as well. The reason you're safer outside is because of the greater dispersion of being in outdoor air. If you have to be inside, increase ventilation, use MERV 13 rated air filters in your ventilation system because they can capture viruses. And I saw a New York Times article recently I thought was really interesting. They called it pick two. You can have three choices. You can be outdoors, you can wear a mask, and you can have social distance. If you have to pick two of those, which means if you're indoors, you can't pick outdoors, so you have to pick a mask and social distance. But if you're outdoors, if it's not that crowded, you can pick outdoors and a social distance. And if you're outdoors in a crowd, you need a mask. So I thought it was a good. It's sometimes hard to sort of. I thought it was a good way to look at how to deal with air quality and being outdoors and being with people. So I'm sure that's my 5 minutes. Thank you so much. I'm happy to respond to questions later if there's time.
Daryl, thank you. And we appreciate all of our speakers keeping us on time here. We're about halfway through our COVID-19 community town hall. I'm just going to pause and recognize our sponsors, and then we'll get to our two subsequent speakers and student activist groups. Our presenting series sponsor is UP Health System Portage. Our additional sponsors include the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, along with their Iron Area Health Foundation, and the Physiological Society. Tonight's topic is focused on the pandemic and how it's impacting our environment and climate, and we have a great lineup of speakers tonight. Remember, if you do have questions, you can send those to us using the Q&A button. You can also email those to us at townhall2020@mtu.edu. And just want to welcome any viewers or listeners that might just be joining us. Any radio listeners out there, if you'd like to see the panel here, everybody can wave for a second. The easiest way to see the visual content, if you head on over to thewolf.com, you can click on the links to join us on Zoom or on social media. So with that, let's continue on. We're going to welcome in Robert Handler. Rob is the operations manager and senior research engineer here in the Michigan Tech Department of Chemical Engineering and the Sustainable Futures Institute. So Rob, the platform's yours.
Everybody, thanks for the invitation. This is a really interesting topic. So in my day job, I spend most of my time helping companies and other groups of researchers understand the potential environmental and economic consequences of their plans to make things in a new way or deliver services in a new way. We're always trying to come up with better and cheaper ways to make fuels and chemicals and materials and streamline our manufacturing process or our ability to deliver energy products or utilities. And we try to help these groups understand what the potential environmental implications of their new activities are going to be. In large part, a lot of that work is motivated by a focus on reducing greenhouse gas emissions and dependence on fossil energy resources, because a lot of our projects are funded by government agencies who have a strong regulatory push to keep lowering those emissions of greenhouse gases, because we know we're causing significant problems for ourselves in the future with climate change issues happening in a variety of scales, which I think our students will talk about later. And for this recent tumultuous year we've been living through, the full picture is still sort of coming into full focus, but it looks like in 2020, we've seen a significant decrease in greenhouse gas emissions, which is not something that happens every once in a while, and possibly presents a really unique opportunity to stop and reevaluate what we're doing and how we might change in the future. So, for instance, the Global Carbon Project estimates that in 2020, global greenhouse gas emissions dropped by roughly 7%, which is the biggest decrease since World War II, 1945. It takes an awful lot of pandemonium to drop greenhouse gas emissions by 7%. But that's what happened. And we've all sort of been talking about why that's happened. People stopped traveling, people stopped industrial activity, people stopped leaving their homes. So all that change rippled throughout supply chains that linked every economy around the country. And obviously the disease linked every economy around the country as well. In the United States, just thinking about domestically, the Rhodium Group estimated that we saw a roughly 10% drop in our greenhouse gas emissions for the country. And that was led by a roughly 14% drop in transportation related CO2 emissions. Everybody sort of gave up commuting for a while, everybody that was fortunate enough to be able to give that up anyways. In the midst of the most severe shutdowns that we were all dealing with in March and April of 2020, there was something like a 70% reduction in our consumption of jet fuel in the country, about a 30% reduction in gasoline, and about a 10% reduction in diesel. And obviously, consumption of those fossil fuels picked up but stayed low throughout the year. Our overall power consumption dropped about 10%, which I thought was interesting. Obviously, many of us are working from home now, but we're still continuing to consume power at home. We're just consuming it differently. But overall, we did reduce our power consumption by about 10%, or at least our emissions from power consumption by 10%, I should note. So when you add up all those sectors, again, we saw about a 10% drop, which actually we sort of stumbled into currently meeting our goals that we set forward in the Paris Climate Agreement. So we're currently at our 2020 agreed targets. Have actually exceeded those, but we still have work to do in order to meet our 2025 greenhouse gas emissions reduction targets. And just because we stumbled into a 10% decrease this year does not mean that we'll be able to make those future goals, because we don't know what the future is really going to hold. How many of these habits that we've developed, that Sonia is studying in her study of households in Chicago, how many of those habits are going to remain sticky, and how many of us are just going to maybe resume our normal ways of activity or even overcompensate for things that we missed out on in the last year? Are we going to be hopping on twice as many flights in 2021 because we couldn't fly in 2020? Are we going to be taking cross-country road trips to fulfill that void that we had in our lives when we were all cooped up for a year? I think it really remains to be seen. We can see a lot of this with the trade-offs in remote work. Some of that might be sticky, but it's maybe it's not all a benefit. There are important trade-offs to consider. What's happening when we're working at home? Maybe we're consuming more single-use plastics, like Rose mentioned, if we alter our behavior in this way, and that's leading to bad environmental outcomes in other categories. So I think it's going to be really important to understand over the next few years what the trade-offs were from this tumultuous year, and think about how we can design new policies or try and encourage positive change to keep the habits that we recognize are good. Maybe we can look around and recognize that we enjoy the reduced air pollution that Daryl mentioned, and try and design our lives and our economies in ways that preserve some of the good while getting back to some of the ways of life that we all enjoy. So that's my spiel. I'll stop there.
Thank you so much, Rob. Really appreciate it. And those unanswered questions there at the end, especially too. We're going to go ahead and move on to our fourth and final formal speaker here. We'll have an opportunity to bring in our students again and open it up to questions. Next, we're going to welcome in Denise Swanke from the National Park Service. She's out on Isle Royale. I hope that we can make the connection here. I know she's got her video turned off, so we can't see her, but we should be able to hear her if she's still here and connected. And Denise, hello, are you with us?
Good evening. Yes, I am. Thank you again for the chance to join you. I'm just trying to preserve the limited bandwidth and keep the video off. So I'm smiling at you all this evening. I just want to build on a little bit of what Rob was saying as I reflect back on March of 2020. I was actually recovering from a significant medical issue of my own unrelated to COVID. So I was coming into the pandemic from what I consider a really strong physical space, but also had a lot of time that I wasn't able to work. So I was paying attention to a thought leader who was really emphasizing to leaders that the pandemic was going to affect us all, from whether you're a business owner or maybe someone like me working in government. Everyone was going to be affected in ways that we certainly couldn't predict, but that there would be opportunity. And I think it's just been interesting tonight to hear some of those highlighted, the opportunities and the positive surprises that have come out of this pandemic. And that's the heating system here. I apologize, I tried to turn it off, so there's some background noise. I've also was reflecting back on kind of the seeds of what we're seeing across the National Park Service, and certainly here at Isle Royale and other parks on Lake Superior. And that is, in 2016, the National Park Service Centennial had a few themes that were find your park, every kid in a park, healthy parks, healthy people, really trying to create new stewards and invite people into parks and redefine parks as anything from your neighborhood place where you get out and go for that walk, right? That folks were talking about earlier, to a national park and everything in between, county parks and state parks. And what we've seen in the National Park Service as a whole throughout the pandemic is really that demand that Rob was just talking about. It really is there. People are discovering their parks, including national park sites, in droves. for the most part. I don't have a lot of Royal statistics because, of course, we were closed for the first part of the season, but our colleagues over at Pictured Rocks had, this winter alone, they had 3 times their normal visitation. Last summer, they had a 41% increase in visitation. And I know other parks in the service who've had similar results. We're expecting quite a significant, more demand than we can meet here at Isle Royal. And I know that's the case in many other parks. It's not a bad thing, but it's an opportunity. A lot of the folks, I came here from Denali National Park in Alaska, and we saw entirely new demographics of visitors. So again, really fabulous to connect with new people or reconnect people in different ways to their national parks. So that's something that's exciting. It also has us leaning on leave no trace principles, encouraging people to do their pre-trip planning, because if you're a first-time visitor and you don't know what to expect, whether it's a state park, a national park, you probably need to do a little bit more work. That's inherent to a visit to Isle Royal, but to a place like Keweenaw National Historical Park, where you drive to the park, or Pictured Rocks and you drive to the park, or Grand Portage National Monument, those places that have easier access, people who aren't prepared for their visit might have some unpleasant surprises. So that's just a reminder. There's a lot of hashtags around recreate responsibly, be good natured, things like that, that I think can be really helpful. Our websites have a lot of terrific trip planning information. And of course, your friendly ranger, whether they're the person cleaning a toilet or working at a visitor center, will be happy to answer questions as well. So I had one little anecdote I want to share on some current research. We just met, myself and a group of superintendents, with folks at the Black Forest National Park in Germany, who are researching the physiological effects of being out in nature. And I'm really looking forward to seeing those published. The results are everything that you think in terms of the positive benefit of being out in nature.
Great, thank you, Denise. I'm going to jump in here with a quick question for you. Given how difficult it's to travel to Isle Royale, what recommendations do you have for folks to get there safely as you're seeing you're anticipating the increased demand this summer, thinking about the 4 Ws that Dr. Cam mentioned in the beginning?
Sure, it's pretty interesting. You know, a year ago, one of the factors we had to consider was we were not able to require people to wear masks. So that took one of the options off the table. But we did have some successful visitation to the park, and we're looking forward to the fact that there are more ways to get to the park this year. We are working very closely with the public health officials, as well as with all of our commercial service providers, to make sure that they have good plans in place. They absolutely do, about how to enforce those Ws and get people here safely. So again, just the trip planning. There's reduced capacity across the board. Some of that's driven by the fact that we have to provide greater levels of social distance and spacing for our employees. So that might mean that we don't have the ability to handle the same number of visitors. But if you can get here, if you can find a reservation, we'll be thrilled to see you.
Appreciate it, Denise. I'm going to bring in our guest moderator, Will Lytle. Will, I know you've been looking at the questions here, and I know we have a couple coming in. Can you help us pose a question to the panel or an individual speaker?
Yeah, so I have, it looks like a question from the audience, which is great. And this question is about, you know, kind of the impacts you've seen and what you're seeing in the local community. What's being done to address some of these stressors? And are things like local food insecurity, you know, medical care, green jobs, improving internet. What sorts of initiatives are you seeing emerging from the community to kind of address or grapple with these things? And I want to note that a lot of these things have been worked on in our community for the last several years, and so don't take credit for just COVID. But I think a lot of these things have remained on the radar when we assumed that they would fall off the radar. You know, if something big disruption or people lost their jobs, that sustainability would fall to the bottom of the list. I don't think it has, but I'd like to hear from anyone that has maybe the Q&A Youth for Climate Action. They've done, I think they're working on food insecurity and food sovereignty right now. And have a great project going on right now.
Well, welcome to being a co-moderator here as everybody's collecting their thoughts. Help us maybe direct the question to, I know with the connection here, but maybe to one panelist specifically to help us get started.
Yeah, I can help you on that, Will. Yeah, we've been doing a project with KYCA doing planting community fruit trees around Houghton and Hancock. And so we've planted about 15 different fruit trees around the community, and that fruit is going to be available to kind of anyone who wants to partake of the fruit. And so we got a grant from Rob J. Greenfield Society last year, and we've just been working for the past couple months to get those trees in the ground, get them planted, and then we have caretakers. So the people taking care of them in the community are all community members in Houghton and Hancock. And yeah, so hopefully in a couple years from now, we're going to have some 15 bright and beautiful pear, peach, apple, and cherry trees up. So that's one of our projects that we're working on for food sovereignty.
I would mention too that in this area of food security and food sovereignty, there's a local group that, like Will mentioned, was not spun up in response to COVID, but maybe that their need has been magnified by COVID. A group called Growing from the Heart, which is a partnership from a variety of community organizations where they're looking to share knowledge and resources to support local food system resilience. So they'll share seeds, they'll share knowledge about how to grow whatever you want to grow in your own space. We're working on trading other resources. Like if I have some space in my garden, I'll post it to the community board and someone can come garden there, or vice versa. So they're really developing a nice collaborative network of people who are all interested in helping out with these broader issues of food security in a host of interesting ways. I think it's going to be exciting to see what emerges from that group. Again, I think they're called Growing from the Heart, and I'm in no ways organizing it. I'm just on their email list, but I think they do great work.
Great, thank you, Rob. I'm going to jump in here with a question, and I'll just ask Will and Kelly to help me continue to check the Q&A button here. So this question came in: what bioindicators should we watch for this summer? For example, will birds, animals, flowers, the night sky look any different? So maybe Denise or Daryl as a start, if that's a fair question to pose to you.
This is Denise. I can say the stars here are we're fortunate that that's probably going to be unchanged. We are certainly initiating a number of studies across the Park Service to do field research last year on those kinds of questions. In other words, with a decrease in some locations of human activity, what is the corresponding change in wildlife patterns of behavior, for example? I haven't seen any of that research published yet, but I know a fair amount of it was initiated over the past year. So that's something to be looking for.
And I can't think of anything you would see, but I would invite you to check the air quality index for your area. EPA maintains a database and a website where you can look and see what the air quality is like where you are. And that would be a good place to check, but I don't think you're going to see anything by looking around.
Thanks, Daryl. Will, I'm going to check back in with you. I think there's another question coming in.
Yeah, we have a great question here about communication and messaging. And so have we learned anything from communicating with the public about COVID that could be used for communicating with the public about climate change or environmental situations?
I did have one comment on that. One thing I saw earlier was with the communicating the slowing of the peak. So to keep slowing the spread to keep hospitals from reaching capacity, and you'll still have a peak, but it'll remain under capacity. And I've seen that messaging be adapted for climate change as well, just slowing your emissions to keep the peak under the Earth's capacity to take the new carbon emissions.
I guess I would say that in terms of messaging, just because you can't see it and because it's not as bad as some places, I assume we've all seen pictures of big cities in China where the air pollution is just astonishingly horrible. And just because you can't see it, I think the message is it's still a problem and we still need to work to address it. And COVID has highlighted the increased health risks for people that are exposed to air pollution. And just another reason for us to continue and push harder to try to address and mitigate these risks.
Thank you, Daryl. I want to ask a question to Kelly Kam, the epidemiologist on the panel. This is, I think, a nice jumping off point. We've heard a lot about herd immunity. I'm wondering if you can help define that for us again, and then also talk about if, when, and hopefully when we reach herd immunity, how long does that last, or does it dip above and below? Can you just provide some perspective?
Sure, and I apologize for the background noise that I have. It's bath time in my household, so there's a hairdryer going on. But yes, so herd immunity, I've also heard the term community immunity. It does come from the agriculture side where it was actual herds. We are a herd of people, and the idea is that in order for something that a pathogen that has to be spread from person to person, it needs to find a susceptible person. So if I'm sick, then I need to be able to come in contact with someone else who's able to be infected for that disease to spread. And if we have enough people in our communities that are vaccinated and are not able to, or natural immunity from being infected, although still get your vaccine if you've been infected, the idea is that there's less chance that I will come in contact with someone who's able to be infected. And so that by our community having a high number of people that are immune, that will actually stop these outbreaks from happening because the virus has no place to go. And so there's a lot of question because this is a new disease. We don't exactly know what level of herd immunity we need to have. So some diseases, it needs to be very high. You need to have upwards of 90% of the population be immune in order to prevent those outbreaks from happening. There's a big question as to what we need. Michigan is looking to try and reach 70% of the population vaccinated. That's the overall population. So we need to remember that right now, the vaccines are not approved for children under 16. So there's a good chunk of our population that can't get vaccinated. There's also individuals in our population who can't be vaccinated adults because they are undergoing chemotherapy. They are allergic to the components of the vaccine. So we need to protect them by kind of cocooning them because the rest of us get vaccinated. The question in terms of whether it'll go above and below, absolutely. So we are not a static population. Children are born, people die. We have a moving population, people immigrate and emigrate. So we need to kind of have that. We do expect that there will be movement kind of up and down as we have new people move into a population and move out of a population, which is why it's really, really important, especially for our more mobile populations, to make sure that they are vaccinated, because they're going to be that group that's moving in and out of other populations.
Thank you, Kelly. I want to bring in two more of our Michigan Tech students here to help us provide some, we're doing good on our time here. We still have about 5 or 6 minutes left, but some somewhat closing remarks here. So we're going to bring in Elise and Gabe from the Keweenaw Youth for Climate Action activist group here on campus. So Elise and Gabe, I know you each have about a minute here to give a plug for your message. So what do you have for our community members tonight?
Yeah, so I'll start off. I'm going to touch on some urgent calls to action they can participate in right now. And then Elise is going to round it off with a message of hope. So one of the things that the pandemic has done to sustainability writ large has been to hamper activist movements, especially those against fossil fuel infrastructure projects. The most relevant examples of which here are the Line 3 and Line 5 pipelines that are being pushed through by Enbridge, which is a Canadian oil company responsible for the largest inland oil spill in US history. Line 3 is currently being constructed in Grand Rapids, Minnesota, and they are in the late stages of drilling beneath the headwaters of the Mississippi This not only endangers the water, but violates the Ojibwe treaties and the 11th Amendment of the Constitution. During the pandemic, Enbridge has labeled their workers as essential at a time when state legislature could not hold public hearings on the pipelines and activists could not assemble. Worse still, Enbridge is paying local law enforcement to intimidate, surveil, and arrest protesters. Through public escrow trusts, Enbridge has paid local county police departments and sheriff offices hundreds of thousands of dollars to oppress any groups protesting the pipeline. So regardless of what side you're on the pipeline, it should be a cause of concern that local law enforcement is being paid by a private foreign interest, especially since they are using this is going to be the same tactics they're going to use when Line 5 starts construction at the next year in Michigan. So even through all this, there's still a strong movement of activism and hope combating the pipeline. And there are a few links to Indigenous-led activist groups that you can follow, like Jinwi Collective and Rise Indigenous, who please, if you have the opportunity to, please donate to them because they really need your help and funding.
Yes, so environmental sustainability can't be achieved without activism. It's currently a huge uphill battle to establish sustainable practices, even just in our own homes. Communities need subsidies, resources, guidance to establish sustainable practices and make it more feasible. But instead, citizens face constant roadblocks imposed by destructive industries with far too much power. People are being arrested and brutalized by police on behalf of these industries. Before the pandemic struck, climate activists have been gearing up to apply unprecedented pressure to the government through huge strategically timed protests. All this came to a halt, but the pandemic exposed connections between climate change, health, and social justice, bringing more movements together in solidarity than ever before. As talked about a little bit before, Keweenaw Youth for Climate Action planted 15 community fruit trees, stood with Ojibwe water protectors to block pipeline construction, and brought fossil fuel divestment to the table at Michigan Tech, all during the pandemic. So please give yourself the freedom to hope for any kind of future, because people are coming together more than ever to build that future as we push through this pandemic.
Thank you, Elise. I want to thank all of our speakers here for donating your time tonight to help keep our community informed, your recommendations, your expertise, and just your guidance in general. We really appreciate it. Thank you to Will Lytle for helping organize things behind the scenes. We did see Pepper, your dog, kind of coming in to say hello as well. So we appreciate her input as well. Also, thank you to Kelly Cam. Kelly, I'll ask you to unmute tonight. Believe it or not, was our 16th town hall since September. So how do you think we did? And it's been a long journey, and again, appreciate all of the insight that you've provided along the way.
I think it's been a great one to end on. I think all of us have been experiencing our environment in a very different way, both our indoor and our outdoor environment. And I think many of us have a new appreciation for what is in our environment. I can say I have an office with no windows. I've really enjoyed working from home with windows and being able to see the environment and appreciate that and think about all of those different aspects that we can take from a positive light that have come out of this has been mentioned here, while still addressing all of those things that need to be addressed, as the students have mentioned.
Yep. I do want to commend our students, Rose, Gabe, Elise, and it might be my screen is changing here as well. So, but thank you to all of our students. You've been a great compliment here. I just need to recognize our sponsors one last time for their support. Again, we've been working on this since September. That includes our presenting series sponsor, UP Health System Portage, Aspirus, along with their Iron Area Health Foundation, the MTech Smart Zone, Physiological Society, and Upper Peninsula Power Company, if I did not mention them yet. Finally, thank you to all of the listeners and viewers out there on Zoom, social media, on our local and sister radio station, 99.1 WIKB and 97.7 The Wolf. You did your part to stay informed and help pass this information on to family, friends, and other community members. And finally, stay tuned to our website. You can catch the rebroadcast on ABC 10 this Sunday at 12 p.m. Eastern. So stay healthy, be well, and have a great rest of your evening. Thanks, everybody.